Right, we first told you Tuesday evening the Trump administration is rolling back COVID vaccine recommendations for healthy pregnant women and children.
Yeah, the unexpected move by the Secretary of Health and Human Services, really a significant change in policy and procedure. Joining us this morning, Dr. Molly, to talk all about it. I know this has caused a lot of folks to have so many questions.
Yes.
I mean, first off, let's start with what has been the most pressing question you've heard over and over?
Can my child get the vaccine? By and large, that is the biggest question. And the answer is maybe not. So right now, the way we decide if a person can receive a vaccine is whether or not they are, recommended to get the vaccine. And what's different about this rollback is it isn't just a change in recommendations. It's actually a restriction on who can receive the vaccine. Now, unless you have an underlying health condition, you are not eligible to receive COVID vaccine any longer.
So what's the basis for this? Is it based on science? Where did they come up with these recommendations?
Yeah, so there was an article published in the New England Journal of Medicine that was based on the severity of illness for a variety of different groups. And it is true that people other than those in the high-risk groups have milder illness. But it is also true that anyone, even without any underlying health conditions, can have severe illness and even die from COVID. What is confusing to those of us in the medical community is why restrict access to the vaccine only to those who in those high-risk groups when we know the vaccine is safe and effective. So most of the time, and in Europe this has been the case, the vaccine is highly recommended for those groups and those high risks, but not restricted only to those groups.
And you can understand why, if a lot of folks in the medical world are confused, you can understand why folks at home are confused,
exactly.
right? So here, I mean, this begs the question of what do you do?
Right.
If I'm thinking about, okay, do my children need the vaccine?
Right.
Do I need the vaccine?
Right.
Who in my family needs the vaccine? Where do I start?
Right. So need is an interesting word. The example I've been giving when asked this question is, if I have a family in my practice, one child has diabetes, they're going to get the vaccine. They're eligible. The family may want to cocoon that child and have the other kids and themselves receive the vaccine to help them stay safe. Right now, they're not eligible for the vaccine.
The other family members are not.
The other family members are not eligible. So let's say the family wants to just shell out the cash. They've got an extra $150, $200 per person to pay for the vaccine. As of right now, I don't think they'll be able to do that for several reasons. Number one, supply issues. The pharma companies aren't going to make a ton of vaccine right now because only people in the high-risk groups can receive it. Number two, if I'm giving vaccine, or anyone is giving vaccine outside of the new guidelines, we're taking a risk in giving that vaccine. And our malpractice insurances may not cover that risk. So the number of people available to give that vaccine is going to be dramatically less.
Yeah, well, we'll have to see for sure where this goes. Right, Dr. Molly, thanks for breaking it down for us and helping us understand.
Yeah.
I appreciate it.